So today we wanted to talk to you about small volume irrigation, which I'm sure many of you have heard, but many of you will probably have a lot of questions. The most common thing we use it for is managing evacuation difficulties if you have an ileoanal pouch or if you have mucus discharge with your stoma, whether you have a pouch with that stoma or not. And I'm going to show you in more detail shortly what I mean. Um, as I mentioned, many of you are familiar with what we do, but I will just let you know quickly about our team, what we do, how you can reach out to us if you need help, and then we are gonna dive into detail about how to use the irrigation, how to manage evacuation difficulties with a pouch or mucus discharge with your stoma, any problems and troubleshooting, and then we are gonna give the microphone to our industry guests so they can help you better to understand how those irrigations are assembled, how they work. Our team consists currently of two dedicated eye pouch and stoma nurses. That's myself and Rally. This is our clinical team. And as I mentioned, though we don't have the picture today, but I'm sure if you go on our website, you can see we also have our well-being team, which consists of our three fur friends, Benny, Bo, and Leo. So they will probably make an appearance later on without invitation, but just look out for it. So how we support people with a pouch and stoma. Always we say to anyone, regardless of where you are, if you have any urgent need of support, you can contact us at any time. We provide video, telephone consultations, face to face if you are in London, and home visits. Currently, we also have a national advice line which you can access 365 days a year. This is including out of our services, whether it's late at night, early in the morning, bank holidays, weekends, we are always available. And we have what we call the rapid response team service, as we pride ourselves being able to triage and respond to, depending on urgency, to anyone that contact us within an hour if it's virtual or remote, and if we need to do a home visit within 2 to 3 hours, again, that would be in London, the visits. Apart from this, we also always work towards education, being patient advocates through research, innovation, publishing, and doing those webinars like tonight to ensure that we raise awareness about pouches, about stomas, and also trialing different products to ensure that we know what's out there and we can offer it to you to help you manage your condition best. And here a bit of pictures capturing what we do, training, especially presenting. And I think many of you would remember in October as well, we did our ostomy awareness walk. We'll be doing one this year as well, so watch this space. We'll be announcing that soon. How you could access our service. As I said, if you need urgent support, you can access without referral. But if you need more complex and tailored advice, we will need your GP or surgical gastroenterologist doctors to give us a bit more detail on your past medical history, why you had the pouch or the stoma, any underlying conditions, and anything that may help us give you that tailored advice. Apart from this, we provide care for anybody that has a pouch or a stoma. And if we think that we need to escalate it to your team of surgeons or medical doctors, we'll do that. and we always pride ourselves as well with the fact that we try to support everyone. We support everyone and ensure that nobody with a pouch or a stoma is left behind, and we are here to support you. One thing we always ask, if you reach out to us, help us better understand what could be the cause of your problems. So we will always ask you to register to our platform and let us know of anything that might help, anything like past medical history, medications you are taking, underlying conditions, because all these things help us paint a better picture and understand things that otherwise, if we didn't know, we may miss on what could be the true cause of your problem. And this is why it's very important you let us know. We have a secure patient platform where you can register, and then this would as well help us have that information, as I said. I'm sure probably most of you know what a stoma and a pouch is, so I don't want to bore you too much with that. But the one important thing to know is that a stoma is surgically created opening in your abdomen, which is used for diverting of waste, whether it's stool or urine, outside the body. And people will need to wear a bag at all times, or the abdomen, a stoma bag, or a pouch, called by some people. The difference with the ileoanal pouch is that that pouch is inside the body. It is made out of your intestine. It sits where the rectum used to be, and it is only function is for stool to be collected, and then for you to, instead of having a stoma, people would have a pouch. Now, talking about mucus discharge with a stoma. It's also known as rectal or anal discharge, but one thing I'm sure all of us can agree could be quite troublesome and frustrating if you need to deal with this. The reasons for the mucus discharge essentially are because you have your rectum and anus that would naturally produce mucus. Whether you have a stoma, if the rectal stump still remains in your body, it would produce mucus discharge. If you have a what we call a loop stoma, and still again you have the rectum in and the anus, it would produce mucus discharge. And in some instances, you might have most of the intestine removed, and then somewhere, usually on the other side of your abdomen or lower in your lower abdomen, you may have a second opening, a second stoma called a mucus fistula, which again would lead to a discharge of mucus. Same goes if you have what we call a double barrel stoma, and also if you have a defunctioned eye pouch, which is dysfunction with a stoma. Naturally, the pouch would still continue to produce mucus, which, depending on circumstances, may become troublesome. And that's what we're going to discuss next. First, it's important to know what is normal. Mucus discharge should be clear or white, sticky, relatively odorless, usually. In the first weeks post-surgery, it may appear beige or dark brown due to mixing with old blood and stool in the rectum. If you have a loop stoma, the mucus might be stained with stool and look similar to your stoma output. That being said, it's important to highlight what is not normal. If the mucus is bright red, black, greenish, or yellow and has unpleasant smell, and it would be something for you to seek medical attention, as it could be, depending on the circumstances, and this is why it's important to assess, it could be a sign of infection. Is mucus always liquid? Is another thing we always have to discuss with many people, and the answer is no. If not pus, in liquid form, it may build up and harden, and this is known as inspissated mucus. The inspissated mucus is thick, dehydrated, and becomes sticky and hard to pass. It can sometimes become solid and resembles a hard lump, or many people actually might sometimes think, especially if it hasn't happened for months and months, that it looks like they're passing stew, but this is just hardened mucus. But if in any doubt, it's always a good idea to also contact specialists to make sure that everything is okay. Again, in detail about what causes mucus discharge, as I mentioned earlier, natural production of mucus is something that the bowel naturally produces, even when disconnected from your digestive system. If you have the rectum in, if you have your pouch, internal pouch inside, the intestine that is made of would naturally produce mucus. For some people, it's hardly ever. Some people have it more often. But when does it become a problem? For example, inflammation and infection. Things like diversion colitis, proctitis, or pouchitis, which would be inflammation of the unused bowel, whether it's in the rectum or the pouch, can increase the mucus production. You can have pouchitis in a defunctioned pouch, which is inflammation of the pouch, and you can have colitis or proctitis in the disconnected bowel of rectal stump. Another thing is if people have anal or eye pouch fistula with those with the pouch, that may also increase. Sometimes might be difficult to tell if it is discharge from the fistula, if it is discharge in general from the mucosa itself, but because of the inflammation, it would often increase. Another thing we have seen in many people is that whether you have the cold, flu, or COVID, though it's not a direct cause of discharge, it can trigger inflammation in the digestive tract, and that would lead to increased mucus production as well. Another thing is radiotherapy effects. If you had pelvic radiotherapy, mucus discharge may persist for years. Now, the important thing to highlight is, as I said, if you have still the rectum or the pouch in, that's when discharge would happen. If you had surgery when that was closed, the anus was removed as well, and your back passage is closed, there won't be any discharge once the wound has healed. If that is happening, and especially if it's something that is new, having foul odor, that is something to indicate often that there could be a wound infection, and you will need to be reviewed to make sure that everything is okay. Now, how we manage mucus discharge. The one thing that would usually be recommended for you to do first would be adjustments to your lifestyle. Now, passing mucus naturally is one thing that often would be something that you'll be advised. Sitting on the toilet daily, especially if you produce a lot of mucus, allowing mucus to pass without straining can help. Some people find it useful if they use a toilet steps too, so they can sit and allow for the mucus discharge to drain. If the mucus discharge is something as well that is happening throughout the day and night, some people find useful to wear a pad or panty liner, as this can help manage the leakage, especially at night or when you are out. Another thing that helps is pelvic floor exercises that can help strengthen anal sphincter muscles and help with leakage control. As that mucus could be irritant to your skin, things like using barrier wipes, creams, sprays could help to protect your skin from irritation or treat any skin damage. And the most important thing is to always keep the anal area clean. keeping the skin clean helps prevent irritation and skin damage. The next thing that usually we will be advised to do is diet and hydration adjustment. Low fiber diet or non-irritant diet, if you have a loop stoma or a double barrel stoma, would help thicken the output because looser output is more likely to actually pass through the second loop stoma opening and travel downstream and end up into the rectum, increasing rectal and anal discharge. Another thing that is important is hydration levels. With mucus discharge, dehydration can make as well mucus thicker and harder to pass for some people. So it is important just as part of your general well-being, but also to prevent complications. Make sure you're well hydrated. Keeping a food diary could be something that may be of help. Some people report that some foods may cause increased mucus discharge for them. So keeping an eye on those, and maybe when you notice increase in the mucus discharge, try to remember in the past 24 hours and or 48 hours what you may have eaten or drank, just to see if there is a pattern in this. Medications. Medications are something that we always say do not self-treat, even if you had the pouch or the stoma for many years. Always consult a specialist. One of the most used things to manage this, especially if you have mucus build-up, would be using suppositories, glycerin suppositories, especially if it's difficult to eliminate the mucus and if it hardens and causes discomfort. Again, if you have a loop stoma or a double barrel stoma and output goes downstream and causes a lot of discharge, using medications like antidiarrheal and antimotility drugs that thicken the output, that would help with minimizing the risk of that output bypassing and going downstream. Antibiotics are another medication that may be of use, but only if the cause is due to infection or inflammation. Otherwise, we would always say that do not use antibiotics unless you double check with a specialist, as there are a lot of risks that can cause you even worsening of your health if you just take them here and there without really needing them. Steroids as well, if the cause is inflammation, especially if you have diversion colitis or pouchitis, this would usually help manage it as well. But again, do not self-treat. If you think you need medication, always consult a specialist. And then management of mucus discharge, the one thing that we are seeing more and more that people find very useful and helping them manage this is the use of medical devices. Now, whether those are anal plugs or inserts that people would usually insert inside the anal canal to help with leakage of that mucus, or the use of small volume irrigation, which would help flush the mucus. And some people may find useful using catheters to help drain that mucus. Again, it is very important that you have an assessment, and I will talk to you shortly about this in more detail, because something that works for somebody else may actually cause harm to you if you are not properly assessed. So please contact a specialist if you need this. Those are the medical devices that we use the most. Shortly after I talk to you about the evacuation difficulties, we're going to go into detail about the irrigation. So the evacuation difficulties with the pouch, I'm sure, are something that anyone that has a pouch probably has struggled at least once or twice since they had that pouch. It is something that could be quite frustrating as well. And The first thing about it is as well is the configuration of the pouches, which often may also contribute to how serious is the evacuation difficulties are. The most common pouches are the J pouch, which is the shape of a J, the S pouch, and the W pouch, with the W pouch and the S pouch being more prone to evacuation difficulties. But that being said, the J pouch also has this. Whether it comes a bit later or not, it would be very individual as well, but they do come with their pros and cons. Some of the most common evacuation difficulties, causes for evacuation difficulties are the mechanical or structural complications of pouches. Sometimes if you have a narrowing, stricturing of the joint, that could cause evacuation difficulties. If the pouch prolapses, again, that would cause it. If for whatever reason your pouch, whether it's configuration or the rectal cuff that remained was longer, that the longer the cuff that remains, the more likely it is to have evacuation difficulties. And as I said, depending on the configuration, it is more or less likely to have them. Functional pouch complications as well as one thing that could cause this, something called dysenergic defecation. This is when your pelvic floor muscles fail to coordinate properly during bowel movements. And also if you have weak pelvic floor muscles, which brings us back to the adjustments to lifestyle and exercises, which I'm gonna mention to you in a bit in more detail. All of this can cause incomplete emptying and this sensation that you still need to go back to the toilet. And diet and hydration could be as well a cause for evacuation difficulties and would influence your stool consistency and your bowel patterns. Now, management of evacuation difficulties. The lifestyle adjustments with a pouch to some extent are similar to those whether you are having mucus discharge, but differ to some things. Sitting correctly on the toilet is the one thing that everybody that has a pouch, I'm sure, has heard multiple times. Pouch configurations and anatomy vary, and so does the correct sitting position. That being said, what we would usually tell you is sit on the toilet, use a step stool, and make sure that your position is right so you are emptying the pouch properly. But then we hear from many people that they need to do something called toilet exercises. You may need to stand up, twist, turn, squat, just to make things running. And this is very individual, but it's something that we find that depending on your pouch anatomy and other underlying conditions could be very specific for you, and this is why it's very important to have this assessment. Pelvic floor exercises and biofeedback, as I mentioned a bit ago, this can help strengthen your pelvic floor muscles, your anal sphincter muscles, improve evacuation. Diet and hydration as well. The low fiber diet that I'm sure many of you are sick of hearing about. We are not promoting or telling people not to eat fiber, but if you're having evacuation difficulties, sometimes things that are high in fiber and difficult to digest, like skin, fruit and vegetable skin, stalks, stems, cores, can slow pouch emptying and leave that residual output behind, causing that sensation that you still have something inside the pouch, which would lead to frequent returns to the toilet. On that note, things that may cause excessive wind or gas production could also affect the pouch, because when wind accumulates in the bowel, it can cause bloating, pressure, and discomfort, which may slow stool movement. It could make passing stool harder due to trapped wind, and it can cause incomplete emptying by interfering with your muscle coordination. And again, hydration levels. Dehydration can make stool thicker and harder to pass, so it is important again to make sure you are well hydrated. Medications. To reduce or stop antidiarrheal and antimotility drugs is something that many pouch patients, when we ask them to do, are reluctant to do because many could be using those for a while, but sometimes they could actually slow things down too much, and that could actually affect how effective is your pouch emptying. So it is something that you may find that you need to try for a few weeks and see how your evacuation difficulties improve, or if not, another thing is using bulk forming fiber supplements. And yes, I just said to you, do not eat fiber, but there is different kind of fibers, and bulk forming fibers is what we call the good type of fiber because it helps absorb water, create bulk, and help things move along and empty better. Um, and speaking of wind and gas, excessive wind and gas, you may need things to help with relieving that. There are medications available out there. Some of them are over the counter. Some of them you may need prescription. Some of them are available over the counter but might interact with other medication you take, especially charcoal. So if you are taking this and you take other medications, make sure that you just run it by a specialist to make sure that you are not taking things the wrong way and causing yourself more harm. Some laxatives or stool softeners can also help loosen output, but only take this if advised by a specialist because having a pouch um, and taking laxatives it's a bit of a tricky subject because it's very individual and needs to be very closely monitored to make sure that doesn't cause you any side effect. I've mentioned already multiple times, I just cannot repeat that enough. Do not self-treat. If you need medications, if you need medical devices, always contact a specialist to make sure that you have somebody that is happy for you to start using those. And when it's about evacuation difficulties, again, small volume irrigation can help flush the residual output and aid evacuation problems. And some people use catheters, which again help drain that residual output. But if you think you need any of these, you can always contact us, or you can contact any specialist that is well aware of your personal circumstances. Now, small volume irrigation is something that is becoming more and more popular, but it's something though that's been around for quite a while now. And those with pouches, but also those with residual rectum, are the ones that usually may have also heard it as transanal irrigation. There are a lot of different brands and shapes available out there. There are some of them that are what we class as medical devices that's been licensed for this, gone through a lot of research to make sure they're safe for you. And there are over the counter things that some people buy off of Amazon or other shops, which though you may find effective, we always advise against it because these devices have not undergone these clinical trials to make sure that they are compliant with regulations and that they are safe for you. So if you are considering using irrigation, please don't just go and buy something off internet. Contact a specialist nurse or a specialist clinician talk about this, see if that suits you. There are a lot of things, as I said, out there, but not everything fits everyone. So it's very important to assess why you need it, what exactly you need, and what is safe for you. Now, using small volume irrigation, as we mentioned a few times already, evacuation difficulties in managing mucus discharge is something that if you take that as a message now, there is a bit more to add to it. The one thing to mention is that if especially that is these evacuation difficulties or mucus discharge is something new for you or something that you think is coming as well with other symptoms that could be troublesome, it may be something that before you start the irrigation, you may actually need to be examined to examine inside the pouch or inside the rectum to make sure everything's okay. Depending on that, you may or may not need to have investigations, whether it's endoscopic or whether you need contrast. If there is any suspicion that there could be any stricture of any joint, you may need that to be dilated or widened, whether it's in clinic or if you may need to have a small procedure in theater. And if there is any suspicion that there could be a mass, you will need radiological investigations like MRI, CT scans to make sure that it's safe, that you do not have anything underlying that you may be not aware of. And if this is the case, that would be always recommended to also do. As part of the risk assessment, as I said, it's not suitable for everyone to just go and grab something. It is important to consider your medical history, any underlying conditions, any medications you are taking, because there are risks. First, the risk of trauma and bleeding. If you're not using the irrigation the correct way or overusing it, it could overstimulate your bowel and actually make things worse for you. Sometimes it could cause vasovagal reactions, which is you feeling faint or nauseated. And there are reported cases of perforation, so it is very important to have an appropriate assessment before you start doing irrigation. But the benefits of it is, if that is the right thing for you, it can reduce inflammation. It can help you to manage any incontinence related as well to evacuation difficulties or not. And it could help reduce mucus and rectal or anal discharge. So once you have that assessment, once you have the green light, we've seen amazing results from the irrigations. So if this is something you think could help you, reach out and start using it as soon as you can and as soon as it's safe for you. These are our contact details. If you want to reach, we are all over social media as well. Our website is here, you can scan. And also we have a WhatsApp which you can see once you go on our website. Thanks. If you have any questions, write them down in the chat, and we're gonna answer those. And before introduce our guests, I just wanted to thank you all for being here tonight, for all of you, and also for our industry guests. I wanted to say that as clinicians, one of our mission always been to promote patient choice and to ensure that whatever is available there for patients is offered to them, they know about it. Aquaflush is one of the systems we use, but there are many other available out there. We always recommend you use, after discussing with the clinician, what works best for you. But today, Claire and Jen are here to talk to you about how that works, how you can assemble it, and the little technicalities of making sure it works the right way once you have discussed it with your clinician and once you have identified that this is the right thing for you. Okay, over to you, Jen, whenever you're ready.
Hello there. Do you want me to, Claire, are you going first or is it me first? Me first. Okay. Hello, everybody. Thanks for your time this evening. So I'm Jen Buckle. I'm a specialist nurse myself. So I'm just going to go through the low volume products that we have for Aquaflush. And I will go through those two of our products, which are the low volume irrigation products. And they are, as Petri said, they are for rectal stump irrigations, people that have got eye pouches, but I always say from the outset, again, these are not just products that you can phone up a manufacturer and just obtain. You must get reviewed and assessed before using your kits to make sure you've got the right product for you, and you've gone through all that hard work of having stomas and surgeries and pouches and things like that. So it's really, really important to make sure that you're assessed for the right kit. So what I'm going to do is just show you the kit really quickly, and I'm actually going to show you how you fill it up with water, because I've got a nice bit of coloured water to show you, and I can't sit still and I'm always on the move. So we have got two different size pumps that we use. One's a low and one's more of a mid-volume irrigation. This one holds about 100 to 120 mils. This one's around 250 mils. So these are what we refer to as low volume irrigation kits, which are for rectal flushes. Great to use with pouches, great to use with people with their defunctioning stomas that have mucus coming out, discharge from a loop stoma, and they're used a lot and they're used very successfully. We can either create a small system with a little L connector on, and all you do is you place on top a cone. And a cone goes on a little bit like an elf hat, I always say. So that cone pushes on, and then you've got a really nice little system there, which is really small and discreet, and you can fold it up really small and take it with you if you're traveling and things. The cone, I will go through the cone separately. We've got a short cone and a standard cone. The length difference is like so, but again, it's important to be assessed for the right kit to make sure you've got the right cone. A lot of people just use the standard cone. The cones have got an eyelet at the top, two at the sides, and that's where the water comes out. The cone is made of soft medical grade silicone. It is really soft, bendy and flexible. So it's really important that when you're using products that, especially if you've got any anal stenosis, things like that, or any soreness, that you're assessed for the right product and the right cone. These are super, super soft. It's going to be very hard to hurt yourself with the soft cones, because they would just bend if you were trying to poke this slightly in the wrong position. Okay, so you can use the mid-volume kit as a mini kit, or you can use it with the small kit again as little kit, and it all depends on how much water that you need. So if you need a small volume of water, we'd usually use this for a rectal stump, or if you need slightly more water, then you can use a slightly higher pump. I generally advise people to use it with the extension tubing, because it's easier to use. I know, because I've tried them all. So it's a lot easier to use all of these kits with a little bit of wiggle room with a pump. You would do all of your irrigation whilst you're sitting on the toilet. You'd sit on the toilet, just pop a bit of toilet paper down the toilet first so nothing splashes back at you. You get lubrication in with all of your kits. So you have a sachet of lubrication per cone, put a bit of lubrication on, you can put a bit of lubrication on your bottom. I tend to teach people to go in between their legs. When you aim for the cone to go in, aim for your chin. You don't want to be poking in lots of different directions, especially with eye pouches. You want to get yourself into a nice angle, cone up and in, and you hold it up in place. So you're in complete control of it and how it goes into your bottom. So it holds into your bottom, push and hold it up, and it creates a seal in your bottom so that the water can go up and in. And it's going to go up and in, and it's going to do a little instant wash out. So water's going to wash in and wash out. It's not designed to hold in there. Please don't confuse it with any form of colonic irrigation. It's what we want to do is just to wash out predominantly the mucus that's in there, or if you've got any fecal matter in there, if you've got a loop stoma, it's just going to gently wash that away. The water just goes in gently and you just do a gentle squeeze on the pump to get the water through. At the end of the pump here, we've got a one-way valve. And I'm going to show you just how we fill this kit up to show you just how easy it is. So I've got my magic coloured water so you can all see it really well. It looks a bit like my witch's brew, I always sort of think. So the water that you used is just plain warm tap water, no soaps, no chemicals, don't add anything to the water you don't need to. Irrigation can be really effective for people that can't tolerate things like glycerin suppositories, or if they've tried glycerin suppositories and sometimes they overstimulate the rectal area in some people. They can be great for some, but for others, sometimes it is a bit of a frustration. I'm just going to tilt my camera down a little bit, so I'm possibly going to chop my own head off, but I'd rather you saw what my hands were doing. So the kits are very simple to use. You've got this one-way valve at the end, so water will go in. Your nice warm water. The water needs to be body temperature water, so the same temperature as the water goes up and into you. Again, as Petra said, if the water is not put in, if you're not taught correctly and you put the water in too quickly, we don't want to overstretch that area down there, and we don't want to end up giving you a vasovagal. If the water is a bit cold, it can be a bit of a shock to the system. So you'd want to aim for the water to be 37 degrees as it goes in. So into the water, the one-way valve goes, and all you do is super easy peasy. For everything that people have gone through with having pouches formed and stomas and surgeries and illnesses, I always think this is an absolute doddle. So as you can see the water is going up and into the pump, and you just squeeze this water through. It is very important that you squeeze the water through so that you get all of the air out. So as you can see, the water's going all the way through until it squirts out at the end, and then all you need to do is pick it up and you're ready to go. If you have little air bubbles through the top, that's fine, they disperse as they go along. If you've got any great big air traps through it, then you would just squeeze the water through. This takes literally a minute, and then you're ready to go. So that is how we use the kits. We usually advise to use the kits. I'm going to just empty this out before I spill water all over myself. We usually advise that you to irrigate after seeing your specialist clinician, who would advise you when to use the kits. Sometimes people can use the kits more frequently, but then they can reduce it down. So if you can get on top of mucus production, then you can use the kits less, but you always need to be advised and supported by your clinician to make sure you've got the right kit for you and you're using it in the right way. And often it's used in conjunction with your pelvic floor exercises and ongoing other treatments if you take other medications. I will mention very quickly that the cones are single use. When you're done with it, a bit of toilet roll over the end, you would just dispose of that in household waste. This whole kit actually lasts for 30 uses, so if you're not using it every day, which you would likely not need, then it can last you for quite a while. Then that goes out in the household waste and it gets replaced, and that's so that the valves carry on working well. Again, the cones are single use. You get a sachet per cone. I'll very quickly go on to, we have little plugs. So again, I would never advise anybody use a plug, especially if they've had surgery or especially complex surgery. You must get seen by your healthcare professional who knows you, knows what surgery you've had and any complexities you've got, but they can be really effective for people. These are just little tiny silicone rectal plugs, little anal plugs rather. So they look a bit funny, but they're tiny. They're little, again, medical grade silicone. They're soft and flexible, and they just pop up and inside your bottom. They just sit in your anal canal there, and you just take out the inserting device there. You just take that out, and this is sitting in your bottom. So this internal ring sits just inside your bottom, and this one on the outside, and you just pull it to come out. But that can hold back some mucus if you've got some mucus that is a real problem for you. So I know some people that would use these just to get through the night if they have some seepage leakage or if they're going out or swimming or they're worrying. And these can stay in for quite a while. They're just silicone. I'd usually say to use one a day if you were using them, but again under supervision of your healthcare professional to get these devices. That is probably me wrapped up. I hope I haven't gone over. Shall I hand over to you, Claire?
Absolutely, thanks very much. So I'm Claire, I'm one of the key account managers for Cleaning Supplies, and I'm going to just give you an overview really of the Nightingale Home Delivery Service. I'm just going to share some slides with you. Please do let me know that you can... No, it's not sharing. Hold on, I'm going to share my screen because I just want to do it straight from... There it is. Helps if you put your glasses on, doesn't it, really? Can you all see that one now?
Yeah.
Okay, brilliant. Sorry about that little hiccup. So Nightingale Home Delivery Service is the delivery service that is aligned with Cleaning Supplies. Lots of different names, and I'm sure it all comes a little bit confusing. So Cleaning Supplies is the overall company, the manufacturer's Aquaflush. So Aquaflush is the product. Nightingale Home Delivery Service is our delivery service. It isn't just a delivery service. So we do provide a fast delivery service for your prescribed products. So those products that are prescribed by your clinician, as we've discussed, they have to be prescribed by your clinician. We use discrete packaging, so it'll arrive in a box that it's unidentifiable as to what's being delivered. And we actually have 3 ways now of taking orders for patients, and we can take orders by the phone, online, or via our new app, which has been supplied from April, I think it was. We've got a dedicated team which are based in Bridgewater, and we understand irrigation, and we offer the appropriate support, especially in the early phases of learning irrigation. So our dedicated team that are based in Bridgewater are product specialists. So obviously you would get your clinical expertise from your referring clinicians, and then we can support you with your product issue. So if you were concerned about putting the system together, or it wasn't quite functioning as well as you were, then we provide a really good support program whereby we telephone you within 48 hours of receiving your order. We then phone you 14 days and 28 days to follow up with you to make sure everything's going well. So it's a really good adjunct to your clinicians, so that we can actually, if you have any issues, we can flag it back to the clinicians and they can see you again. It's you actually feel supported throughout the whole of the journey, really. So here's just an example of our Nightingale Home Delivery app, which you can download from the App Store or from Google Play, which makes it really simple and straightforward for you to order your repeat products once you've had them prescribed. If you wanted to have a look and see why we sing our praises, we are rated as excellent on Trustpilot for our home delivery service, and some of the quotes on here from our customers really speak volumes about the work that our dedicated team do. So the staff are without exception loyal, dedicated and professional. It's very quick, hassle-free delivery, fantastic customer service and support, and really speedy delivery. And I think sometimes when you get a summation of reviews of almost 1,700 people and you still come out with a score of that, I think that's something to be said for the team in Bridgewater, definitely. And that's me, really. So that was just to provide you with an idea that actually we do manufacture the products, but we also have that additional support available for you once you're using the products, should you come across any eventualities. Thank you.
Thank you, Claire.
Okay.
That was very informative. I wanted to also thank Aquaflush and Cleaning Supplies, and through them as well, Jen and Claire, for being here with us tonight. I hope you enjoyed the night. I know it's been a long evening and a long day for you as well, so thank you for making the time and being here with us this evening, and spending that almost 2 hours with us. So thank you.
No problem. Enjoyed it. Thank you.
Thanks for the invite.
Thanks everyone, and those of you that have more personal questions, feel free to reach out. And again, thank you all for being with us tonight. Bye.
Thank you.
Bye bye.
Thanks. Bye bye.